Good afternoon, everyone. My name is Martina James, and I am with the Governor's Conference on Aging. We are thrilled you're joining us, and we are going to let everybody get in and get settled, and we'll start in just 1 minute. All right, everyone. Thank you for joining us today for our October webinar. We are thrilled that everyone could be with us. We had over 500 people register today, so we're really excited about that. We want to not only thank all of you for joining us, but thank all of our sponsors and our partners, our presenting sponsors. Dominion Energy, Virginia Housing, and AARP have been long-term continuous sponsors of the conference, as well as our conference partners, the Virginia Association of Area Agencies on Aging, as well as Department of Aging and Rehabilitative Services. Without these organizations, we wouldn't be able to do what we do every day and bring you this webinar series. Also, thank you to our steering committee that decided that this was a really important piece that we implement as we shifted the Governor's Conference on Aging to May of 2021 due to COVID. Today's webinar is the unique challenges of social isolation during the holidays, and we have several fabulous presenters that are going to join us. Before we get into that, I just want to remind people of our November webinar. Our webinar series is usually always the 4th Tuesday of every month, but in December and November, we're bumping it up a week. So November, we hope you'll join us on the 17th from 1 to 2 p.m. And the webinar is Serving Rural Older Americans. The answer is yes. And that presentation is going to be by Donna Harvey, the CEO of Northeast Iowa Area Agency on Aging. So again, we hope you'll join us in November. Also, we want to highlight some of our great sponsors and exhibitors that are important to the conference, as well as our presenting sponsors. Genworth and Peer Place, again, long-term supportive sponsors of the conference, and we couldn't do what we're doing without them. Some of our exhibitors that were slated for 2020 and you'll be able to visit in 2021, Virginia Relay, ADT Health, and Bankers Insurance. You can also find information about each of these sponsors on the VGCOA website. So when you go to look at the recording of this webinar, take a few minutes to visit each of our sponsors and exhibitors and learn a little bit more about what they do. They're taking the time to invest in us, and I hope as attendees, you all will take the time to learn about what they do and how they support aging services, not only in their own communities and across the Commonwealth, but across the country. So at this point, I am going to hand the presentation over to Catherine. Give me 1 second, Catherine, and I will share my screen with you.
Okay.
All righty. And you can go ahead and get started.
So Pam Teaster is having difficulties connecting, so she sent me her script, and I'm going to go ahead and read it. And it starts with a Christmas carol. One of the two portly gentlemen benefactors who visit Scrooge in his counting house approached him, wishing to enjoin him to make provisions for the poor and destitute at Christmas time. Said the benefactor, We chose this time because it is a time of all others, when want is keenly felt and abundance rejoices. Indeed, want is more keenly felt at the holidays, precisely because those who have less are more bombarded with the sights and sounds of the abundance around them. Thus, it is that this VGCOA webinar addresses the unique challenges of social isolation during the holidays. Hello, my name is Bert Waters. I'm the Associate Director of the Virginia Center on Aging, and hopefully Pam Teaster can get connected into the webinar to continue this, but I'm going to read her original script. Social isolation is associated with about a 50% increased risk of dementia and other serious medical conditions. Loneliness and social isolation in older adults are serious public health risks affecting a significant number of people in the United States and putting them at risk for dementia and other serious medical conditions. A new report from the National Academies of Sciences, Engineering, and Medicine points out that more than 1/3 of all adults aged 45 and older feel lonely, and nearly 1/4 of adults aged 65 and older are considered to be socially isolated. Older adults are at an increased risk for loneliness and social isolation because they are more likely to face factors such as living alone, the loss of family or friends, chronic illness, and hearing loss. Loneliness is the feeling being alone, regardless of the amount of social contact. Social isolation is a lack of social connections. Social isolation can lead to loneliness in some people, while others can feel lonely without being socially isolated. The first speaker is Catherine MacDonald, a gerontologist based in Richmond. She focuses her work on bringing gerontologists, change makers, and other community members together to develop and implement community-driven, evidence-based solutions. On the topic of social isolation and connectedness, Catherine has presented for national academic and scientific conferences such as the Association for Gerontology in Higher Education, the Gerontological Society of America, Aging 2.0, Optimize, the Intersection of Innovation and Aging, and the Southern Gerontological Society. She earned her master's degree in gerontology from the Virginia Commonwealth University. She has lived in Richmond for 14 years. Currently, she lives with her husband, son, and their cat in the Carillon neighborhood. Fun fact, Catherine once appeared on an episode of The Real Housewives of Beverly Hills. Our other panelist is Matthew Fullen, an assistant professor at Virginia Tech, where he is faculty in the counselor education program and affiliate faculty in the Center for Gerontology. Dr. Fullen's research focuses on older adults' access to mental health care, community-based suicide prevention strategies, and the pursuit of wellness and resilience across the lifespan. Fullen's work on expanding Medicare mental health access has been nationally recognized by the American Counseling Association. He currently serves as co-principal investigator on an Administration for Community Living grant to address social isolation, loneliness, and elevated suicide risk in older adults. Although the holidays this year will require some adapted expectations, Dr. Fullen looks forward to spending time with his family in small, safe gatherings. Here's another fun fact. Speaking of family, Dr. Fullen's family was on the game show The Family Feud in the early 1980s, then hosted by Richard Dawson. So I have a question for the two of you. The first question is, what do we know about the negative effects of social isolation and loneliness?
Thank you so much, Bert. I'm going to start us off with the answer to this question, and Pam's script did a really great job of outlining this just now, but I have a few more important frameworks to share here, because we've been learning more and more about how social connectedness is a powerful and protective health practice. Many studies have shown that social isolation can have a worse impact on our health when compared to well-established negative health impacts, such as those of air pollution, obesity, smoking 15 cigarettes a day, or consuming 6 alcoholic drinks a day. As Pam overviewed, lack of social connection can negatively influence our physical health. It's highly associated with cardiovascular disease, high blood pressure, risk of falling, and premature death. Interestingly, we're seeing that researchers are also establishing key links between social connection and other social determinants of health, in particular housing stability, which I think I'll get a chance to talk more about later on in this presentation. But for now, I'd like to pass the mic over to Matt because he has some additional COVID-specific information to share.
Thanks, Catherine. Yeah, COVID has impacted rates of social isolation and loneliness. You know, we hear about this, we hear allusions to this throughout the news media. It's something that I think is on everyone's minds. We are starting to see some data that is really demonstrating how these impacts are being felt. So the University of Michigan National Poll on Healthy Aging asked a sample of adults ages 50 to 80 about lack of companionship and isolation, loneliness, and health behaviors. This study was done in June of 2020 and was a follow-up to a 2018 study in which they asked similar questions of a different sample of 50 to 80-year-olds. And in a nutshell, what they found was that 41% of people felt a lack of companionship here in 2020 compared to only 34% in 2018. 56% felt isolated from others, which is about double what the response was back in 2018. And 46% reported infrequent social contact, which was a significant elevation from what had previously been found as well. The Kaiser Family Foundation has a similar study that they've been doing on the impacts of COVID on social isolation and mental health. What they found is that currently about 1 in 4 adults over age 65 reports anxiety or depression, and this was done in August of 2020. And this is a rate that's been relatively stable since the start of the pandemic. So 1 in 4 older adults experiencing clinically significant anxiety and depression during COVID-19. And this is quite a bit higher than the roughly 11% of older adults who reported anxiety and depression back in 2018. So again, we're seeing that COVID is having a uniquely challenging impact on mental health for older adults as well. I should note that the rates of anxiety and depression among older adults are still lower than they are for other age groups. And so this is not to say that most older adults are struggling, but the fact that 25% are is something that we should be well aware of. We collected some data from a sample of homebound older adults just prior to COVID. And so this is additional information about the impacts on mental health care within a fairly socially isolated sample of people. One of the things that we found was that nearly half of this homebound older adult sample met criteria for anxiety, about 1 out of 4 criteria for depression. 1 in 2 had experienced daily pain. And then when it comes to mental health distress or suicide, the numbers are continue to be concerning as well. About 15% of this sample met clinical cutoffs for suicide risk. Nearly 1 in 4 reported a history of suicidal ideation or behavior. And alarmingly, 65 of these 493 older adults in our sample reported at least some possibility that they would consider ending their lives in the future. And so these are key takeaways that we wanted to bring light to in terms of the levels of social isolation and loneliness, but also mental health distress and even suicide risk within the aging network. We also found that attending congregate meals seemed to provide a buffer against social isolation, which makes sense. Congregate meal gatherings, a good source of social connection. But in the COVID era, obviously concerns related to physical distancing are changing the way that the aging network has to do business. And there are concerns that some of these adaptations do raise some of the risks for social isolation and disconnection as well. Pam, we'll throw it back to you.
Thanks, Matt. I was feeling fairly socially isolated myself for just a little bit, not able to get on GoToMeeting, but now I'm here, so I feel more connected. But I was going to ask you, why is social connection so important anyway?
In a word, relationships make the world go round. And so whether these relationships are with partners, family, friends, beloved aging network staff, neighbors, or otherwise, we know that relationships are essential to aging well. Experiencing loneliness, feeling disconnected from friends, having a small social network when we would prefer otherwise, and even grieving a recent loss can all be predictive of experiencing greater loneliness. The quantity of relationships matters to a degree. Having a larger social network does predict more access to relationship resources. On the other hand, we know that it's normal for older adult social networks to narrow later in life, likely indicating an investment in fewer but more emotionally meaningful relationships. And so it's really important to think about social connection and relationships holistically, that there is a need for quantity, but also especially for quality. And it turns out that the best high quality relationships in older adulthood are those that feel reciprocal. Meaningful relationships are those that we experience as supportive, but they also provide us an opportunity to give support to others and not just receive it. So the quality of the relationship goes a long way, and being able to answer questions like, will my loved ones be available when I need them most? It's also interesting to note that social support is in the eye of the beholder. One study by Dan Blazer and colleagues found that a person's perception of social support predicted mortality, and the authors concluded, quote, the feeling of being embedded within supportive and caring relationships may be at least as critical to health outcomes as the actual supply of social resources. And this is really a fascinating thing to consider when we're talking about some of the detrimental aspects of social isolation and loneliness. As was mentioned earlier, loneliness has to do with this feeling or this perception of not having the relational resources that we would prefer, regardless of the number of people that might be in your life. And this is actually pretty consistent with some of the leading theories around psychological crisis and even suicide. The leading theory, Thomas Joiner's interpersonal theory of suicide, suggests that when people start to feel a high degree of perceived burdensomeness, that they no longer, that they're a burden on their loved ones, that their loved ones would be better off without them. And then when they also start to feel a greater sense of thwarted belongingness, meaning, an interest in connecting and trying to connect and feeling like those efforts are not reciprocated. These two variables, perceived burdensomeness and thwarted belongingness, really work together to create some of the predictors of suicide desire. And so these things, finding relationships where we don't feel like a burden, where we feel needed, and where we feel like we have reciprocal care are really essential to what healthy relationships are all about. And I do want to pass this over to Catherine and have her share with us a little more about a framework for thinking about social connection.
Yeah, thanks, Matt. And I'm glad to see you, Pam. I'm glad you're here. So I'd like to lay out a framework here for how we can talk about what exactly is social connection, and that'll help us also think about how it benefits all of us. Because for older adults and for people of all ages, social connectedness is a key protective buffer against negative health outcomes. So when we're talking about what is social connection, I'd like to reference Dr. Julian Holt-Lundstedt's framework here. You can see on your screen, hopefully the PowerPoint looks correct now. So Dr. Holt-Lundstedt is probably a familiar name to those of us who are interested in this topic. She's the pioneering scientist in this field. Truly, she provides a really helpful framework with her typology of social connection seen here. And I want to look at the three dimensions of social connection through the lens of family and holidays today. Structural supports, the first one here in yellow, these represent really objective measures and status of social connection. Functional supports are all about individual experience and perception. Now, these are the kind of factors that for some of us may be very heightened around meaningful days like holidays. We have shared meanings and importance on certain days, maybe like our birthday or Thanksgiving, and perceived support or perceived loneliness can be more poignant because of that on these days, at least in my experience. Likewise, received support and connection can feel even stronger. Quality supports can play an especially important role around the holidays, especially this year. Our positive relationships are such important buffers right now, and they're what's getting us through. They're what gets us through losses anytime, but particularly maybe with the loss of tradition or gathering this year. If on top of physical distancing and canceled events, we're also experiencing negative aspects or difficulties in our relationships, that's going to introduce more challenges and perhaps be felt even stronger in the 2020 holidays. And in general, we can see and feel the ways that these three dimensions of social connection benefit us every day. Your social network provides you with access. Maybe that's getting a ride somewhere, to an appointment, running errands, Our positive relationships give us encouragement when we need it, but for us, that stress relief is so key. We mirror our pure health behaviors like nutrition and exercise. Our social networks provide us with that. Our friends, family, loved ones, our relationships in our life help us advocate for ourselves and others. They represent our best interests. They provide us with accountability and personalized information. If I know that something has come up and I need to see a dermatologist, and I can call someone and say, hey, do you like your dermatologist? Like, would I like them too? Should I go there? That's all about our social network. Those are some real experiential, tangible elements that we get out of good social connections. Pam, do you have another question for us?
Well, I do, but Matt, you can go ahead because Matt's going to talk about the link between social isolation and the holidays.
Yeah, I just wanted to piggyback off of what Catherine started to talk about. So we know that the holidays are going to be particularly challenging here in 2020. But let's be realistic that the holidays can be a challenging time regardless of the year for certain people. And so it's important for us to acknowledge that and acknowledge that the holidays can be a time when gatherings with friends and family, all of the bells and whistles connected to the holidays can be a source of stress or a source of discontentment for some of us. One of the things that comes up particularly is grief during the holidays. Catherine alluded to that, and I wanted to mention a few things beyond about that. Amy Morin, a licensed clinical social worker, writes about the impact of grief during the holidays in a 2015 Psychology Today article, and she talks about how we have to be kind to ourselves and create space for grief and recognize that while we see other people, commercials, things that alert us to the joys and the exuberance of the holidays, that for some people that can also be a really difficult time. So she reminds us that we should trust that grief is part of the healing process, that it's important to set healthy boundaries during the holidays, and that we should focus on what we can control, that we should plan ahead, allow ourselves to feel a range of emotions, find a way to honor memories, and even create new traditions if we need to. That this is a time when we can do something kind for others, and also a time that we can ask for help. And it struck me that these are really good principles for us to consider this year as well. We know that due to COVID, the holidays will look differently. We know that CDC guidelines are encouraging restrictions around family gatherings, particularly larger family gatherings, and that will create many logistical challenges, where some of our typical traditions, typical things that we might want to do with friends and family may be disrupted. So I think it's important for us to consider the things that we can and can't control, to make plans, to have open communication with our loved ones or with our care recipients about some of their needs during the holidays, and to be willing to create some new traditions in hopes that things may look different and possibly more normal in 2021. And this really strikes a chord when you think about people that are spending the holidays in continuing care retirement communities or other congregate living situations. We at Virginia Tech have a clinical mental health counseling internship at a local CCRC, and one of the staff members there was telling us about how many of the people who live in that community are gearing up for what is bound to be a very different holiday season. And she asked us if we could provide some workshops or create some dialogue within the people that live there about how to protect your mental health during the holidays, especially when you're experiencing sadness. Maybe your sadness right now is outweighing some of the joy and exuberance that you typically have. She reminded us that sometimes, you may not feel as much a part of the holiday gatherings, either because you can't attend, maybe the food no longer sparks an interest. Your children, grandchildren, great-grandchildren may have different holiday plans, and you may not feel like you're a part of that. And so these are all things that are very important to consider and important to give some space for people who are struggling to think about what the holidays will look like this year. We want to give them space to be able to start some of that grieving process, and to not pretend that simply by sweeping these things under the rug that they will no longer exist, when the reality is that likely many of us are experiencing some form of grief this year, in 2020, due to the pandemic. And so I hope that we can acknowledge that and allow that to be the starting point of finding some things that we can do this year that will be meaningful and memorable.
And with that in mind, I want to bring up a topic based on conversations I've had over the years, and this extends to pre-COVID and this year certainly. Something that people talk about a lot is that for those of us who experience economic insecurity, the holidays can be extra stressful. It affects the kind of gatherings and events you can be a part of sometimes. This year, in addition to everything else, many people are feeling that kind of economic insecurity and that kind of stress. And we've been learning a lot about the role of social connection in this topic. So I do want to share a little bit of information about that. Because even before COVID started, in long-term supports and services, providers have found themselves becoming more and more familiar with the consequences of economic insecurity and long-time wealth exclusion, such as housing instability among their clients. We've been seeing rising rates of older adults experiencing homelessness, for example, and many are experiencing homelessness for the first time in later life. So for the past few years, gerontologists have been spending a lot of time looking at this trend and trying to find answers and interventions. And very interestingly, researchers have noted an important link between older adults experiencing housing instability and homelessness and social connection. Here in Richmond, VCU gerontologists partnered with Homeward, the umbrella agency that provides homelessness services here. We selected and administered the De Jong loneliness scale among older adults during an annual point-in-time count. Among older adults who are single, the majority reported that they lacked social supports by several measures, and they're laid out here on the slide. And then globally, gerontologists have sought to identify the pathways, in particular to older adults experiencing homelessness for the first time late in life. And the two distinct pathways they identified, they call it gradual pathway and rapid pathway. For both of those pathways, social connectedness plays a key role. So there's been a big push for awareness of our need to be thinking more about social systems as a social determinant of health in order to prevent more older adults from experiencing homelessness and housing instability. This issue has two main angles, which are increasing social capital and making it okay to access one's existing social capital. I highly recommend this article by Drs. Victoria Burns and Tamara Sussman. You see it here on the screen. It provides some great recommendations. But in thinking about the holiday season, we can all do our part to help with this too, in whatever role you find yourself. We can avoid language that perpetuates our emphasis on self-sufficiency and independence, because the truth is we all need one another to thrive. The holidays are actually usually a time we celebrate that notion. Across traditions, holidays are about gathering, maybe sharing meals, gifts, and stories with one another. It's a time when we celebrate our connections, our caring for each other, our love, and our support. So this year, we can all strive to emphasize these values and traditions when we need it most, and I hope we can carry that spirit through 2021 and beyond, because we really do need each other to thrive.
So that was really nice. I appreciate those thoughts. So, Matt, tell me about the state of the behavioral health workforce, because it seems to me that if there was ever a time that we would need them, it is all the gathering events that we have coming up, starting with this weekend. So talk to me about what's the state of the behavioral health workforce, both in urban areas and the harder run and rural areas.
Yeah, this is an issue that is really important, and hopefully is becoming more prominent in the public's awareness. So, there have been periods of time when we have been slow to talk about the mental health needs of older adults, slow to talk about some of the benefits of mental health services for this population. But whether it's due to serious issues like anxiety, depression, or even suicide risk, or whether it's due to family stressors, trauma, grief and loss, navigating social disconnection, we know that counseling and psychotherapy are effective ways to address these issues, as well as other mental health supports that people can receive. There are numerous studies that show that therapeutic support provides value above and beyond medication only. And for example, with major depression, the standard of care is medication plus counseling. And so there are many benefits to this sort of approach. Unfortunately, there's currently a lack of behavioral health providers who are approved and equipped to work with older adult clients. So the number of mental health professionals who specialize in gerontology or geriatrics tends to be less than 5%, and in certain disciplines even lower than that. And this led the Institute of Medicine to describe the lack of behavioral health workforce as a crisis, and a crisis that is having an outsized impact on older adults. Some of these workforce issues may stem from long-held stigma about aging, or outdated beliefs that mental health care doesn't work for older people. However, there are also systemic issues at play, particularly related to Medicare, which people, as they age, increasingly rely on for access to health care. Mental health provider policies haven't been updated since 1989 under Medicare, which results in a misalignment between which professionals are covered and which are available in one's community. And unfortunately, this is an issue that Medicare beneficiaries face sort of alone because private insurance, Medicaid, VA, TRICARE have updated their policies in recent years. We're actually trying to illuminate this Medicare mental health coverage gap in some of our research at Virginia Tech. And I do encourage those on this call who work with Medicare recipients to remain attuned to issues like anxiety or depression, and to not assume that these are normal parts of aging. They are not normal parts of aging, and they're highly amenable to treatment, but it can be challenging to find Medicare-approved providers, especially depending on where you're located. We know that particularly within rural areas, the mental health workforce is already a more shallow pool. And then when you add in this Medicare reimbursement restriction, it ends up narrowing that availability even further. And so we've been talking to some providers who are very concerned about their Medicare clients' access. And unfortunately, that means, some of these needs go unmet. So something we're trying to work on, but something that we really need additional concerted efforts to change policies and make these attitudes about aging and mental health more open and more a part of our discussion.
Oh, thanks, Matt. I'm glad you're working on that, and I know a little bit about that. That's comforting to know, but I know you have miles to go. So, Catherine, tell us about how the Aging Network is poised to address social isolation and loneliness. It seems like there's a network across the country that we know about. What are they prepared to do?
Absolutely. And I can speak mainly about where we've been looking in the Richmond region, which is reflective of what's happening across the country and globally, certainly. Because, for a number of years in this region, we've had a great network of folks working on this topic, especially addressing how emerging evidence related to social connection can be brought into play. And so, of course, I'm going to go back to my Holt-Lundstedt social connection typology to kind of share an example with y'all today. And I want to acknowledge some of the folks involved, including Sarah Link, Dr. Thelma Watson, Gigi Amato. Gigi has helped me so much with this presentation, by the way, so big shout out to Gigi, VCU Gerontology, the Longevity Project, and others. What we know is that there is a whole host of folks who are lonely and they have identified as such. But what about getting ahead of the issue? And how can we use our knowledge about social connection as a prevention framework? So what people have begun working on is using the Holt-Lunset typology of social connection and other frameworks of social connection and social isolation, and seeing how we can align it to the tools we have when we're providing services within the aging network. So taking this typology and applying it to the Virginia UAI, many people in Virginia use the UAI, and is very similar to other instruments used across the country and the world. This is just one we have here, and it's what feeds into No Wrong Door. So my kind of call to action today would be to be on the lookout for certain risk factors, certain elements of this framework from the evidence. And let's talk about how we can use these as a preventative tool, perhaps. I've color-coded here structural, functional, and quality, where you can see how these elements have aligned to the UAI. For example, marital status and does anyone live with you? These are elements of structural social connection. Other things that you do that you enjoy. How often do you talk to the people in your network? Those are both structural. Functional includes your satisfaction level, perceived satisfaction with how often you see or hear from folks, whether you feel alone or don't have anyone to talk to. And then quality, do you ever feel like you don't want to be around other people, or are you experiencing the stress of family conflict? So whether you use the UAI in your role or maybe a different onboarding tool, this kind of invites us to think about the people in our lives and how these factors apply to them. Examine how we onboard the people that we work with or who we help. Are we seeing these types of elements represented? And could this be an opportunity to reach out with support during the holidays? Even if someone hasn't overtly identified themselves as lonely, maybe it gives us that nudge. And then my other approach I want to be sure to bring up in this context would be about listening. In the aging network, in long-term supports and services, these are real relationships. We have an opportunity to hear and listen, to maybe make some jokes or just try to laugh together, which can release a lot of stress. And we can all practice listening a little bit differently. And this extends to folks maybe who don't currently work in the aging network. We can all do this, right? So in addition to thinking about the opportunity of quantity, when we're making that phone call, we're scheduling that Zoom meetup, let's think about coming into that interaction in the right state of mind, and let's call folks with the right intent and purpose. Maybe that means eliminating distractions and really focusing on the other person, being very present and listening deeply, because that can make a really important impact when folks need it most, like the holidays this year. And I think Matt has some great input here too.
Yeah, thanks, Catherine. I want to share a little bit more about some of the work we've been doing within the Aging Network. The Aging Network has such a valuable part to play in addressing social disconnection and social isolation and loneliness for many of the reasons Catherine just mentioned. There is a source of connection and hope that emerges, even if that's not the technically on the job description in certain capacities. It's that point of contact that can really brighten a person's day and make make the rest of the day that may feel fairly socially disconnected much more worth living. We've been working with colleagues at Georgia State University on a grant funded by the Administration for Community Living to look at home delivered meals programs as a possible source of not only nutrition and some social connection, but also to use those programs as a means of addressing psychological distress, loneliness, and even elevated suicide risk. So we've been training HDM volunteers in about 6 counties in the southeastern part of the United States in the ASSIST program. And ASSIST is the gold standard for crisis intervention, suicide intervention. Think of it as sort of a psychological CPR training. And so these volunteers have been learning about how to identify and connect with individuals who may be really experiencing distress. And by integrating these skills into a home delivered meal route, our hope is that we can truly function as more than a meal and address not only nutritional needs that older adults have, but also socialization needs. And this is consistent with what is written in the Older Americans Act. It's consistent with what the Aging Network already is positioned to do quite well. And we're finding that using HDM volunteers in this way has been very meaningful to them. We've been conducting qualitative interviews with some of these participants, the volunteers themselves, to find out their experience with this program. And what they've been telling us is that they really rave about the value of the assist training. They find it meaningful. They experience it as an investment in their role as volunteers. And many of them believe that their assist skills are emerging and they're increasing in their confidence at being able to use some of these skills to intervene when they notice that a person is struggling and they're concerned about that person's safety and well-being. We've had to make some adjustments due to COVID-19. We started to ramp this program up, and then COVID hit and we had to make some adjustments right off the bat. But we've been fortunate enough to hear from these volunteers about the promise of using assist in this way and leveraging some of the skills and dispositions of HDM volunteers so that the volunteer workforce can really use many of the skills and the gifts that they already have to address more than just the nutritional needs. And we're hearing from these volunteers that they really enjoy the interactions, that they sometimes wish they had more time to invest in these encounters so that they could really get to know their clients and have better opportunities to do interventions if one is needed. And so that got us thinking about how to expand the responsibilities of this part of the volunteer workforce and to get them thinking about more dynamic ways to use their skills, particularly during COVID, when many of these volunteers were not able to participate in their meal delivery in the same way that they had historically. And so we started to re-envision what would it look like if the HDM volunteers were also engaged in some phone-based social connections with the people on their routes. And so, think of this as a bit more of a holistic relationship that is being developed between the volunteer and the care recipient. You may still be the one who's delivering that meal, but you're also someone who's checking in, who's finding out about how to address things like social disconnection or loneliness. And we developed a resource here that you can access from the National Nutrition Resource Center on Nutrition and Aging. The URL here will take you to this resource, but it's really just meant to be some tips about how volunteers and other staff might improve these engagements and really begin to increase their investment in the human relational needs that many of these older people have. So again, that it's not just addressing those nutritional needs, but also doing something much more.
Thanks, Matt. I think it is fantastic that you're piggybacking off services already provided, particularly the vital nutrition services and cultivating an older adult volunteerism in older adults has been a holy grail that I think becomes and remains untapped. So to sort of, as a sort of last question, tell us about how protective factors that we might have, and then what we can all be doing to reduce stress. And please move us beyond exercise and diet, because I think we know that. So tell us some good tips about things that we can do.
Thank you, Pam. I would love to share an idea here with everybody. And this might be a familiar study to some of the folks listening, because for me, when this came out, I thought this was fascinating. There's a lot of really helpful information out there about ways to increase positive social connections and preserve protective factors of social connection. And I want to talk about this one in particular, which is about the idea of wisdom as a protective factor of social connection. And this is out of some super interesting work from UC San Diego. So first, let's go over what is wisdom exactly. This team of researchers from UC San Diego identified 6 attributes from the existing wisdom literature and evidence. They say the 6 most commonly included components of wisdom from all the reading that they did is number 1, general knowledge of life and social decision making, like the ability to give good advice, life knowledge and life skills, social advising, emotional regulation, how we can have control and affect our regulation and self-control, pro-social behaviors, such as empathy, compassion, altruism, a sense of fairness, insight, the ability and desire to understand oneself and one's actions at a deep level. Value relativism also can be described as tolerance for divergent values, being non-judgmental and accepting of other value systems, and decisiveness, or the ability to make quick and effective decisions. So those are the components of wisdom. We take that, and in a follow-up study conducted by the team that developed this, they examined the prevalence of wisdom and loneliness, and they chose a very wide range of ages, from people in their 20s to over 100 years old. And this study actually found a strong negative association of wisdom with loneliness. So that suggests that wisdom as a concept, as a characteristic, may be protective against loneliness. And it's a potential target for interventions to reduce loneliness. Like if we can work on these skills, that might be a lot for our social connectedness skills building and loneliness reduction. And here's a quote from the study. It says, persons who were wiser were less lonely. Interestingly, very few individuals were lonely and wise, or not lonely and unwise. These authors also noted that there are more similarities than differences among wisdom traditions and concepts around the world. So that made me think of the holidays, right? Because that's when we celebrate a lot of our traditions and cultures. And so I'd like to take the chance, in the spirit of the holidays and this topic, to think about wisdom in our own lives. How do we learn about wisdom, and how do we deepen our own wisdom? So there's a really simple activity here that we can all do together on this topic. What I'd like to ask folks to do is visit menti.com and enter the code 2570786. And please share with us a pearl of wisdom from your culture or your family holiday traditions. This could be a little story, the name of a story, or a piece of scripture, a quote, the name of a folk tale, or the name of a poem from a tradition that's part of your life. It could be from your religion or your family, the region where you're born or where you live now. So if you go to menti.com, menti.com, enter 2570786, you should be able to plug in your pearl of wisdom. And as you are thinking of your pearl of wisdom, I would invite you to consider how does that pearl that you've selected demonstrate the link between wisdom and social connectedness? How does your pearl relate to social advising or pro-social behaviors, tolerance for divergent values? That's a big one. Oh, good. I'm seeing them come in. These are great. Everyone can see these, right? Take that as a yes. While we're sending these in, Matt, I'd like to bounce back to you for some of your thoughts too.
Yeah, these are great. It's fun to see these kind of roll in, and it allows us to, to sort of practice what is a major antidote to social isolation, and that's just community, experiencing kind of the shared wisdom and shared experiences of one another, even people that come together on a webinar who we may not have met in person, to be able to learn from each other and to share some of the things that make us, commonly human. And it strikes me that as we're sort of wrapping up our time and thinking about the unique challenges of social isolation during the holidays, and how we are anticipating that the holidays this year will be particularly trying for many of us, I think there were three things that really stuck with me as we were preparing for this. So one is to not lose sight of the fact that we are very resilient people, and the loved ones, the friends, the family members, care recipients, people that we work with, even those who are struggling and feeling socially disconnected, that they are resilient and have the capacity for resilience. And when I say that, I don't mean that they should just pull themselves up by the bootstraps or anything like that. But what I mean is that inside each person that we come in contact with is the capacity to not only bounce back, but to bounce forward, and to talk about the ways that they have survived what has been a difficult year, and to talk about how they look forward to and look ahead to what they hope will be a new year that will also have its share of difficulties, but a year that will also have its share of joys. And so resilience being one of the things that, when we can see this in one another, especially those who are otherwise struggling with social disconnection or loneliness, that we really do them a favor, and we bless them by doing that. Another is to engage in healthy and honest communication this holiday season. I was reflecting back to family counseling and couples counseling work that we do, and sometimes we really together, you'll hear about these frictions or these tensions that occur during the holidays. People are trying to navigate their first holiday together, and there's a lot of expectations that may or may not be met. And so when you're working with people navigating the holidays for the first time, you want them to be upfront about their expectations and their needs and their desires. You want to be honest about challenges and barriers that you might face. And you want to connect over some of the barriers. So you come together and make it sort of an us against the world sort of thing. And I think the same thing happens when we're engaging with family or friends or care recipients here during 2020 and the holidays, that we can connect over some of these things and see it as a challenge that we're going to face together. And it's important then to communicate openly and honestly about what our needs are this holiday season, and the need to stay safe and the need to be socially engaged, maybe at odds in certain ways, and yet we want to be able to have some honest conversation about how my needs and your needs can both coexist. And then, the third piece that I wanted to share is, again, just the importance of reciprocal relationships. So the best relationships, the ones that really do protect us from feeling lonely or socially disconnected, are those relationships where I am needed just as much as I need someone else. And so I encourage you, as you're thinking about your relationships with people who may otherwise strike you as somewhat socially disconnected, to think about ways to communicate to these people not only the ways that you care for them, but the ways that you experience some of your needs being met by what they provide to the relationship. So reciprocity, not just about us donating our time and energy to others, but also reflecting the ways that your relationship and what you give to me is meaningful. And so with that, I want to hand it back to Pam to kind of close us out.
Okay, thanks, Matt and Catherine. Really great. So during this time, we recognize that want really is keenly felt, as Charles Dickens says. And I think some takeaways quickly are that if there was economic insecurity before, it exists in many ways now, as our news tells us every day, of businesses that close, some that open, stock markets that go up and down like roller coasters. You talked about transitions. Homelessness, for example, we know there's a lack of people being able to even visit in ways that they had done before. And we also understand that these problems exist sometimes in rural areas even more, particularly mental health worker issue that you talked about, Matt, more than others. I'm going to cut to about two or three questions that we'll have time to. And if a dog barks or whimpers, you'll know that it's mine. And so here is a question. Have either of you heard about certified peer specialists to be a source of support when providers are not available? HHS had a webinar about non-medical peer specialists. Does this exist in Virginia? Is it a way to bridge a gap between need and numbers of practitioners? Either one of you.
I can't speak to the mechanics of certified peer specialists and how that functions here in the Commonwealth, but what I can say is that conceptually, that's very much in alignment with some of the things that we're finding, where when you develop a volunteer workforce that is already motivated to help, already has relationships in place and some of the skills necessary to address these social isolation issues, that really becomes a nice way to expand their sense of responsibility, expand their job description, so to speak, to be able to address additional needs.
Another question, I think, Catherine, this is probably for you. So the documents of the UAI are confidential, and here was a question about how are you getting information related to isolation without breaching confidentiality?
We certainly wouldn't want anyone to violate anyone's HIPAA or confidentiality. I do hope, though, that what I've been able to help with is providing a lens, perhaps, when we're onboarding folks for opportunities to enhance our assessments and a different way of thinking about this. So maybe people have opted into a service, and maybe there's a chance to build in another logic in the conversation, potentially, when someone hasn't opted in, but we can make sure we're offering in case that flag pops up. And maybe it's not with the UAI. Maybe it's maybe it's just from a one-to-one conversation you're having and it's not in a formal setting like this. But I do hope we can start to think about being preventative. And, admitting you're lonely is really hard. That's a hard thing to do. So not everyone's going to come out and say it did quite like that. So any opportunity we have to offer preemptively, I think is great.
One last question. Who does the training of assist for volunteers? Do they get certified in some way?
The assist program is operated by LivingWorks, and LivingWorks has a series of protocols in place. So the people that provide the assist training are certified as trainers. They have to go through, it's about a 5-day training that then authorizes you to be able to provide that assist training to other people. So in our study, we have used 2 assist master trainers who are very familiar with the assist program and who have also been working to make minor adaptations that allow the assist program to be customized for use within the aging network. And the assist program itself is much more general in terms of what it's trying to do, but we are making those adaptations so that we can really zero in on what does this look like with older adults who may be at risk for distress, and how do we tailor some of the pieces of this so that it really can be most useful within the aging network.
Great. All right, Martina, I think it's time to wrap up. I want to thank Catherine and Matt for really wonderful information. Great slides. That's particularly like the closer. And so maybe Martina, you go ahead and close us out.
All right, so I just wanted to share each of our presenters' contact information. If anybody has any questions, each of these individuals, I'm sure would be more than happy to follow up. I do encourage you, if you reach out to them, please put VGCOA webinar in the subject of their email so they know what you're referencing. Again, thank you everybody for joining us. Thank you for being patient during the technical glitches at the beginning. As long as we've been doing this, it's inevitable. It's still going to happen. So we appreciate your patience. Again, this session is being recorded and it'll be posted to the VGCOA website within 24 hours, and you'll get a follow-up email with that link. Just a quick reminder for our Tuesday, November 17th webinar from 1 to 2 p.m. It is called Serving Rural Older Americans. The answer is yes. Also, during this presentation, Lori Stahl from Loudoun Area Agency on Aging sent us a quick note that Loudoun Area Agency on Aging is doing a Coping Through the Tinsel and Tears session on Thursday, November 19th from 1 to 2 p.m. And to get registered for that, you can email aaa.support@loudoun.gov. And what we'll do in our follow-up email with the link to this recording, we'll include that event information for both our November webinar as well as Lori's session she's presenting. So again, thank you to our presenters. Thank you so much to all of our sponsors, not only our presenting sponsors, but our featured sponsors. We hope everybody will take a few minutes to go to the website and check them out. And we look forward to seeing everybody again next month. Thank you so much. And thank you for your patience at the beginning of the hour.
Thank you.
Thank you.
Thank you.
And happy Halloween.